we're quickly trying to look at a surgery, okay, which is done in the urinary tract. Okay, so this was a Clam Ileo-Cystoplasty. So anytime you see cysto, of course the surgery is done on the bladder. Okay, so Clam Ileo-Cystoplasty, you can see a summary of it from number 1 to number 6. Okay, so bladder is cut open, a section of the intestines is removed to patch the bladder up. Okay, so they are using some part of your body to arrange some other parts of your body, you know. So it's a surgical procedure which is used to enlarge the bladder using a segment of the ileum. So like you open the bladder, then you kind of like you patch it up, making it bigger. Okay, so you know, it's typically performed in patients with refractory bladder dysfunction such as Detrusor overactivity, neurogenic bladder, or low bladder compliance. So what is Clam cystoplasty? Let's define terminologies. So it's also known as ileocystoplasty. It's also known as Clam cystoplasty. It's also known as bladder augmentation. The bladder is small. You want to add its capacity. You are augmenting it. So bladder is surgically split open like a clam, and a segment of the ileum is cut. Now it's now sewn to now increase the capacity of the bladder. Are you following? So it can be performed via open surgery or laparoscopic. Okay. So indications. Why will you want to do this type of surgery? Neurogenic bladder, Detrusor overactivity, low bladder compliance, so it's risking kidney damage, refractory urinary incontinence, bladder outlet obstruction. So procedure overview, they usually do anesthesia, the bladder is open and splitted, so a patch of the ileum will now be cut, okay, sewn into the bladder to make it bigger. Okay, so the part of the ileum where you cut, you now reattach them, right? So catheters are now placed for about 2 to 3 weeks, okay, after the operation. So patient might need to stay in the hospital for about 7 to 10 days. Okay, so lifelong monitoring for complications like bladder stones, metabolic disturbances, mucus production, and all have you.